When we're talking about common causes in the second and third trimester, bloody show due to cervical insufficiency once again, as that cervix has difficulty closing and filling with that mucus plug and or maintaining the weight from amniotic fluid, placenta, and baby, you can start to get bloody show would just simply be some of that uterine lining kind of coming out, might look a little bit like some clotting you see during menstruation, but it would not be a menstrual cycle. It would not mean necessarily anything horrible, but it would be an indication of that cervical cyclage needed again, or maybe bed rest. Obviously, if you're in labor, you're going to get some bloody show. A placental tear, which can happen, where you can see the placenta is right here, where that placenta could, oops, I'm sorry, I didn't mean to click that, start to tear away from the uterus. You'll get some spotting. Placenta previa, where the placenta is down here at the bottom of the uterus instead of at the top. And then a uterine rupture. These are all very, very severe things, very, very rare, but they are possibilities. Okay, any of your infections, urinary tract infection, yeast infection, can cause some spotting just due to irritation. So just making sure, once again, listening to your body. Any of your active herpes, genital warts, anything like that could cause some spotting or bleeding due to irritation as well. Once again, miscarriage in the first 20-ish weeks is really truly due to a defective embryo. Your body is going to say something isn't right. It's not because mom ate spicy nachos and had a beer before she knew she was pregnant, or she did a CrossFit class. It's really truly in that first trimester, even into a little bit of the second trimester, really the body's saying something's not right, and we need to expel this pregnancy through miscarriage and then try again later on. Okay. When you lose a baby after 20 weeks, that is going to be a pregnancy loss. Okay. That's not due to a defective embryo. That's due to a myriad of other complications that could have arisen. Sorry. But 25 to 30% of conceptions end in some form of miscarriage. There's a lot of times people don't even know they're pregnant. And what they think is a really heavy menstrual cycle could possibly have been a miscarriage. And you just didn't know. Okay. Obviously, do not write this red. Okay. That's just extra stats for you. But yeah. And then how your body changes during pregnancy is really, really, truly going to vary on the individual. I told you that most pregnant women will go up 1 to 2 bra sizes during their pregnancy. And you can just see the growth based on the tissue, the glands, all of it swelling. You obviously are growing a new organ. That would be the placenta. You swelling, hands, feet, arms, legs. Your hair, positive with all the prenatal vitamins. A lot of times you have really kind of nice, soft, glowing skin, nice, thick hair. Your bones will soften because your pelvis needs to be, and I'll talk about this in the prenatal 2 information, but your pelvis will have to shift open to allow for baby to transition during labor and delivery. So your bones do have to soften. Increased blood volume with the placenta, the uterine lining, and then getting blood to baby from mom. I talked about the skin changes, your veins. I had somebody ask once, why do pregnant women get this vein? We all have a vein that runs from the sternum to the pubic bone, but as baby is putting more pressure on the skin and stretching it, this vein becomes more prominent. And blood under the skin just appears to be this kind of brownish red color. So it's just a vein. It's normal. You will see a lot of times where the belly button wants to kind of pop out. And then stretch marks. Think about the abdomen. If you think about kind of the back of your spine down at the bottom of your like pelvis in the lower back. Now imagine pulling all of that skin around to the front. You'll see a lot of times the stretch marks come from this back area or these sides as that skin is being pulled around to the front. Sometimes you'll even see it on the top of the thigh in that kind of that same general area. Okay. Lots of creams and solutions that people sell to prevent stretch marks. It's really, a lot of it has to do with the amount of collagen in your body, how elastic your skin is, on how well it stretches. And for some people, their first pregnancy, they do great and they don't get stretch marks until their second or third, because as we age, we lose elasticity and collagen in our skin. And so it's less likely to stretch as naturally. So this is just great pictures to show you, like these women are all at the exact same gestation, meaning they're all right around like, I'm going to guess they're probably in their 36-ish week range. Okay. But just look at the difference in their body types. You got a little bit shorter. Women who are a little bit shorter in nature have less torso. So they a lot of times will pop out a little bit more. Baby has less space to grow up and down. Where you have this woman who is a little bit taller, so her belly isn't quite as big because baby has more room to spread this way. Okay. You have someone who maybe was a little bit overweight. I mean, you can see some of the stretch marks here. But just truly, same gestation, every single person carries baby differently. Okay. This is just a nice picture of how it's wearing the same rough outfit. Just look at the difference in things like her face. Okay. From here to here, swelling in the face, swelling in the hips and the legs, the arms, breast tissue has grown. Okay. So it doesn't all just go to baby. And then this is a great indicator of, once again, you see all of these organs, okay, all now slide up kind of underneath this rib cage. Okay. You have your lungs, you have your stomach, you have intestines, you got it all. Okay. And then your kidneys, all of that comes down here. So baby takes up room. All these complications that we're going to talk about, difficulty breathing, getting comfortable, those types of things truly happen in those last several weeks. And then last slide, but not least, really when we're talking about some different terms, dilation and suction, D&C, if for some reason you have a miscarriage or a pregnancy loss, they may need to go in and do a D&C, which is a dilation and suction of the uterus. This is a medical procedure where they would go in and they would remove all uterine lining, all tissue from the uterus due to miscarriage or pregnancy loss at some point. When you're having all of these different tests and things done, one of the things you really truly want to be careful of, x-rays, making sure you wear the apron. You don't want to expose baby to radiation. Cigarettes, any nicotine. Nicotine speeds up the heart rate. And when you speed up mom's heart rate, it's a stimulant. Nicotine's a stimulant. You speed up baby's heart rate. So with nicotine, you typically see low birth weight babies because you're speeding up their heart rate throughout the pregnancy. They're burning more calories. Less calories are put on as layers of fat. Okay. Weaker lungs, greater risk of SIDS. We'll talk about that in newborn phase. Sudden infant death syndrome due to heart defects, lung defects, where a baby just dies in their sleep. Okay. Nicotine with that increased heart rate and lung complications has a higher rate of SIDS. Alcohol affects your baby's brain development, and it can have what is known as fetal alcohol syndrome or damage to their brain and their heart. And a lot of times these are some facial feature abnormalities that happen with fetal alcohol syndrome. Any of your prescription drugs, you have to make sure that you're telling them you're pregnant. There are a lot of really safe drugs, prescription drugs to take while you're pregnant, but there are some that have known birth defects. So you want to make sure that you disclose to all doctors that you are pregnant or have a possibility of being pregnant. And then illegal drugs really can truly affect brain, heart, lungs, really horrible side effects. I mean, you shouldn't use illegal drugs anyway, but yada, yada. Okay. And then one of the things that, and I'll talk about thalidomide a little bit more. All of our hospitals currently have this program where you can go in and you can rock babies. And a lot of times it's these drug addicted babies that need a little bit extra love because they're born addicted to drugs. And they have to go through detox in their first days of life. And one of the things with drug addicted babies is they truly just cry. It's their only outlet for communication. And when they're in the hospital, they just want that extra affection. This is just a great video to show that. And I hope I have enough time to show this video. I'm going to run out of... let me turn the volume on. Sorry. This is just a great video about volunteers who go in and rock babies in their spare time. That was just an example. Once again, our hospitals do offer this program. You do have to be 18 to go in and rock babies and have a background check. But it's great volunteer work and it's amazing. That is the end of Prenatal 1 information. I will do a review when I am back in on Monday. I apologize for getting you the information this way. This isn't normally how I do it, but we'll do a review on Monday or Tuesday if I have you Tuesday. And then we will, I'll answer any questions and we will carry on to prenatal 2. Thanks, guys.